Welcome back, friends. Welcome to my channel. Please subscribe to my channel. So let us go forwards and try to see the Sparta's fourth lesson. So in the head and neck, what are the other things which we are going to learn? So far we have seen the vessels, we have seen the arteries and the veins, and the glands we have seen the parotid gland, thyroid gland we have seen, and submandibular salivary gland we have seen. And today we are going to see the muscles, how to identify the muscles in examination. So the first and foremost muscle which usually in the examinations they put is sternocleidomastoid muscle. It is very easy to identify. So to understand this sternocleidomastoid muscle, so it is occupying entire the neck, and it is oblique in pattern. The fibers will be running obliquely. So it is having two heads, sternal head and the clavicular head. Both heads they joins with each other and forms a belly, and it is extending upwards and reaches to the mastoid process. So entire the neck is occupied by this sternocleidomastoid muscle. That is how we can identify in the examination. So what is the next question they may ask in the examination is, what is the origin, insertion, nerve supply they may ask, or they may ask, what is the innervation, nerve supply of the sternocleidomastoid muscle they may ask, or what are the movements of the sternocleidomastoid muscle they may ask. Okay, so that is about the sternocleidomastoid muscle identification. Yes, here you can identify that sternocleidomastoid. Then moving to the next muscle is superior belly of omohyoid. How to identify the superior belly of omohyoid? So after reflecting the sternocleidomastoid muscle, only then we can identify these strap muscles. Okay, so identifying of the superior belly of omohyoid. So they try to identify in the anterior part of the neck. Try to identify in the anterior part of the neck, just below the hyoid bone. Below the hyoid bone, one muscle which is running obliquely. Okay, one muscle which is running obliquely, that is nothing but the superior belly of omohyoid. Okay, so that is forming the antero-inferior boundary of carotid triangle. Antero-inferior boundary of carotid triangle. So like that, if it is present exactly antero-inferior to this common carotid artery and the internal jugular vein and the vagus nerve, that is nothing but the superior belly of omohyoid. What they may ask next question is nerve supply. They may ask nerve supply, and how, what are the boundaries, what are the triangles it is forming, the boundaries to which triangles they may ask. Okay, so like that they may ask regarding the superior belly of omohyoid. Here it is. Okay, then moving to the next muscle is strap muscle called as sternothyroid. Try to see this sternothyroid muscle. So this sternothyroid muscle which is extending from sternum, and it is extending upwards and reaches to the thyroid cartilage. So thyroid cartilage, it is present at the almost uh, just lateral to the midline structures of the neck, midline. So it is extending upwards and reaches to the laminae of thyroid cartilage. So it is a strap muscle, it is vertically present. Okay, so the vertical muscles are sternothyroid, sternohyoid, and then above the thyroid cartilage, that is nothing but the thyrohyoid. Okay, so try to identify if it is extending up to the hyoid bone, that is nothing but the sternohyoid. Okay, if it is extending up to the thyroid cartilage, that is nothing but the sternothyroid. Okay, like that you can identify the sternothyroid muscle as well. And the next question they may ask is the nerve supply. Nerve supply they may ask. Yes, coming to the next muscle is anterior belly of digastric. To identify this anterior belly of digastric, definitely they have to stretch the neck, and they have to pin this muscle. They have to pin this muscle. So try to identify just below this mandible. Just below the mandible, you can identify one muscle will be running posteriorly. One muscle will be running posterior towards the hyoid bone. First it runs the fibers, then runs downwards and reaches to the hyoid bone, and then posteriorly we can identify another belly. So probably they doesn't ask the posterior belly because there is a slight confusion may happen in the examinations, because stylohyoid will be there, stylomandibular ligament is also running along with the posterior belly of digastric. That's why they may not ask the posterior belly of digastric. But remember the anterior belly of digastric muscle fibers, they are running downwards and backwards, downwards and backwards. So that is to identify the antibelly of digastric. So nerve supply they may ask, antibelly of digastric muscle, nerve supply they may ask, and the embryological consideration, okay, embryological illustration they may ask. Okay, so from which arch the muscle develops, that is a question they may ask in examination. Then mylohyoid. Mylohyoid, to identify the mylohyoid, it is very easy to identify. Just below the mandible, deep to this digastric muscles, deep to the digastric muscles, we can identify this mylohyoid muscle fibers. So right and left mylohyoid muscle fibers, they are meeting at the midline. That is forming the raphe, mylohyoid raphe, which is present extending from the symphysis mentae to the hyoid bone. So that is to identify the mylohyoid muscle. Okay, so for this muscle also they may ask the nerve supply and action they may ask. What are the relations they may ask? Mylohyoid muscle superficial relations and as well as the deep relations they may ask regarding the mylohyoid muscle. Next muscle is orbicularis oculi. So surrounding the orbital cavity, that is covered by this orbicularis oculi. So they may ask the parts of orbicularis oculi. So orbital part, palpebral part, lacrimal part, these are all the parts you have to mention in the examinations. Okay, so that is to identify the orbicularis oculi. Next one is orbicularis oris. Surrounding the oral cavity, that is nothing but it is lined by orbicularis oris. Here also they may ask the parts. Okay, they may ask the parts of the orbicularis oris and they may ask the nerve supply of this orbicularis oris or sensory innervation of this face they may ask. Okay, so that is to identify the orbicularis oris. Yes, coming to the next muscle is masseter muscle. How to identify this masseter muscle? Masseter muscle, which is arising from the zygomatic bone and also the lower part of the zygomatic bone and also the lower part of the zygomatic arch. So the muscle fibers will be running downwards, backwards, and they are reaching to the lateral surface or external surface of ramus of mandible for insertion. So on the superficial surface of this masseter muscle, we can identify the parotid duct and also the facial nerve branches which are running over it. So that is how we can identify easily. On the lateral aspect of face and in front of the parotid gland, they may pin this muscle and ask you to identify it and identify the pin structure. And next question, maybe they may ask, so what is the action caused by it? Action of the masseter muscle or nerve supply of the masseter muscle, they may ask in the examination. Here it is. So these are the muscle fibers of masseter. And next muscle is lateral pterygoid. So this lateral pterygoid, to put this lateral pterygoid muscle, they need to do a fine dissection and they have to expose properly and ask you in the examination to identify this lateral pterygoid muscle fibers. So it is having two bellies and the two bellies which are arising from the lateral surface of the lateral pterygoid plate and also the infratemporal surface of greater wing of sphenoid bone and the two heads which are running posteriorly, two heads running posteriorly and they reaches to the pterygoid fovea which is present exactly in front of the condylar process of the mandible. So to expose that, to show that they need to remove the ramus of mandible, they need to remove the ramus, small part of the ramus of mandible and also the coronoid process of the mandible and also the zygomatic arch they have to cut. So whenever they are showing or asking any muscle after removal of this coronoid process and the ramus of mandible, you have to be careful and they may asking the lateral pterygoid and also the medial pterygoid. Okay, so in this picture on the screen we can identify two different heads are present here. So these two different heads, they are the fibers of lateral pterygoid and below that we can identify another muscle fibers that is nothing but the medial pterygoid. So it is a bit complicated, so probably they doesn't ask this question, but remember if they ask you have to find out if there are two heads are present, one is coming from above, another one coming from the inside, that is nothing but the lateral pterygoid muscle. Okay, so they may ask the nerve supply and they may ask the action of this muscle. And next muscle is temporalis muscle. It is very easy to identify. Definitely they have to remove the zygomatic arch or perhaps they does not remove. If they doesn't remove the zygomatic arch, they have to clear entire the scalp and expose this temporalis muscle clearly and ask you to identify this pinned muscle. Okay, so it is a large muscle, it is a fan shaped muscle which is arising from inferior temporal line, inferior temporal line. So on the lateral view, normal lateralis, so if you study the skull from lateral aspect, you can identify the temporal bone, then you can identify the parietal bone, and also you can see the frontal bone. So from the lateral aspect, they keep this uh, temporalis muscle and ask you to identify this triangular shape or fan shape muscle. Okay, so that is nothing but the temporalis muscle. Same thing they may ask, what is the action or what is the nerve supply, and what is the other question they may ask is what is the fascia covering that temporalis fascia. Okay, so that is the questions usually they ask, or they may ask the origin, insertion, nerve supply. The last muscle which we are going to identify, we are going to study is the trapezius muscle. So if they put the body in the prone position and expose the posterior aspect of the neck, skin, superficial fascia, if they remove these two, the largest muscle which we can identify here is nothing but the trapezius. Okay, so sometimes they may ask you, they may put the body in the supine position and expose the posterior triangle of the neck and ask you to identify the trapezius. That is also very easy, where we can identify the anterior border of the trapezius, you can identify in the posterior triangle. Okay, so that is how we have to identify the posterior triangle, and also we can identify the trapezius muscle. Okay, so next question might be origin, insertion, nerve supply, and action, they may ask. Okay, origin, insertion, nerve supply, and action of the trapezius muscle. So that is about the identification of these muscles. In the next class, we are going to identify the skull foraminus, how to identify the skull foraminus, and what are the skull foraminus usually they ask in the examination, and what are the bony prominence they may ask, suppose styloid process, mastoid process, what are the other things they may ask in the examinations that we will see, and also the terion, asterion, bregma, lambda, these are all the things we are going to discuss in the next class. So be attentive and prepare for examinations. Don't worry, don't get panic in the examinations. So whenever you are going through the spartus, be calm, try to find out all the spartus, try to study the questions properly and observe the specimens properly, then easily you can identify, you can get the marks. Thank you, dear friends, all the best.